Good morning. My name is Balana and I am the Injury Prevention Officer for Workforce Engagement here at Injury Matters. Today we have Dr. Monanita Ghosh and Dr. Hyun Nguyen present Understanding Social Frailty and its Association with Falls.
Thank you.
Before we begin, please let me acknowledge the Whadjuk Noongar people who are the traditional custodians of the land on which Injury Matters work, and recognise Aboriginal and Torres Strait Islander peoples' continuing connection to the land, water and community across Western Australia and Australia. I would also like to acknowledge the traditional custodians of the land on which you are joining from. Before we start, I'd like to go over a few housekeeping points. Please make sure your microphone is muted. This will allow all attendees to hear clearly. We would love to hear your questions, so we strongly encourage you to please send them through the chat box throughout the presentation, and we will go through them at the end. If you have more than one person in the room with you listening to today's webinar, we would appreciate it if you could please let us know via the chat tab to let us know how many people are listening in with you. If you face any technical issues during the presentation, please write them in the chat box and we will do our best to help you. I have Joe helping me here today. We will have a QR code at the end of this presentation so you can complete a short evaluation on this webinar. If you could please keep that in the back of your mind, that would be great. To protect attendee and presenter privacy and data, Injury Matters prohibits the use of artificial intelligence-driven systems and technologies, such as automated note-taking, recording, or transcription tools during the following this webinar. Thank you for your cooperation. So just about Injury Matters. At Injury Matters, we innovate and deliver injury prevention and recovery solutions that empower individuals, organisations and policymakers across Western Australia to make smarter, safer choices. We develop life-changing, life-saving programs that keep people safer and healthier, at home, at work and on the go, and mitigate the far-reaching physical, emotional and financial harm caused by injuries and trauma. But just as importantly, we're continually innovating new solutions. As a not-for-profit organisation, we collaborate with local communities, industry, government, and our health, emergency and social services partners. As injury prevention and recovery specialists, everything we do is based on the latest research, evidence, and lived experience. Our three programs aim to raise awareness of injury risks, consequences, and solutions, prevent injuries through a range of education and support programs, and support the recovery of people, families, and communities impacted by injury and trauma. This training is brought to you through our Stay on Your Feet program with the support of the Department of Health WA. The Stay on Your Feet program provides information, training, and support to older adult community members and professionals working with older adults on how to prevent falls in the community. Stay on Your Feet has three key messages that we use throughout our campaign and community and workforce engagement. These three messages are move your body, improve your health, and remove hazards. This is where we get our overarching slogan, move, improve, remove. Falls are a significant public health issue in Western Australia. It is seen that 1 in 3 people over the age of 65 fall each year. The 2024 WA Falls report highlights that in WA someone dies every 17 hours, is hospitalised every 16 minutes, and presents to the emergency department every 12 minutes due to a falls-related incident. Falls can result in a real impact on an individual's life that can lead to a loss of independence and confidence, increased concern of falling, and difficulty doing daily tasks. Social frailty is a multifaceted concept defined as a continuum of being at risk of losing or having already lost social resources, social behaviours, social activities, and self-management abilities necessary to fulfill basic social needs. It is a significant predictor of physical frailty and psychological decline and is associated with adverse outcomes such as falls, disability, and even mortality. I would now like to introduce our guest speakers for today. Dr. Monanita Ghosh is a research fellow at the Edith Cowan University Social Aging's Futures Lab, where she leads the arts and music engagement stream. With a dual background in anthropology anthropology, and public health, her research delves into cross-cultural influence on health, behaviours, aging, social care, health service evaluation, and the role of music in migrant health. Her work encompasses training, capacity building, and community development, thereby bolstering health and social care initiatives across diverse populations. And Dr. Hyun Nguyen is a research fellow at the Social Aging Futures Lab within the School of Arts and Humanities and serves as project manager for the International Decentering Migration Knowledge Project. Her expertise extends across aging and well-being, diversity, migration, gender, and development with engagement spanning international development organizations, government bodies, and UN agencies. Welcome. I will now pass you on.
Yeah. Oh, so my microphone is. Thank you, Elena, for this beautiful presentation, introduction. Instead of wasting of time, let's get back to the job. So our presentation is understanding social frailty and its association with folks. We respectfully acknowledge the traditional custodians of the land on which we gather, the Whadjuk Noongar people. We pay our respects to their elders, past, present, and extend our gratitude to all Aboriginal and Torres Strait Islander peoples who are with us today.
Yeah, thank you, Banana, and the whole Israel Matters team to host this event today. So before our presentation, let's take a moment to brainstorm on social frailty. So each of you, please choose one keyword or phrase that you feel best describes social frailty and share the chosen keywords and phrase in your group chat. We will review and discuss them together later. Yeah. So now I have a question for Mononita. What is frailty?
Yes, so frailty is a complex age-associated syndrome without an universally accepted definition. Frailty makes people more vulnerable to handling stress and coping with life events. It significantly increases the risk of serious health issues such as broken bones, falls, disabilities, depression, lower quality of life, hospital stays, and even early death.
Yeah. So frailty is a multi-dimensional construct, and it encompasses three key dimensions: physical, cognitive, and social. These dimensions are interconnected, with each influencing and shaping the outcomes of the others. A decline in one area can contribute to vulnerabilities in the others, highlighting the need for a holistic approach to understanding and addressing frailty. Next, please.
So early conceptualization of frailty is dominated by the concept of physical phenotypes, which focuses on the presence of at least 3 of 5 criteria, which are weakness, slow walking, speed, low physical activity, fatigue, and unintentional weight loss. That was the frailty concept that has been medically and has been very dominated until now.
Yeah. So, what about the cognitive frailty? It is a syndrome characterized by the coexistence of physical frailty and cognitive impairment without a clinical diagnosis of dementia. It is associated with an increased risk of adverse health outcomes, including falls, injuries, disability, and depressions, highlighting the need for early identification and intervention. Next, please.
The researchers now recognized the biosocial psychological model of health, and it says that a person's health is shaped by many factors, including their surroundings, social connection, physical health, and mental well-being. When these factors are not well supported, it can lead to social frailty. Social frailty means losing or being at risk of losing important social connections, like family or friends, or not being able to take part in social activities that fulfill basic needs. The concept of social frailty is still evolving, and researchers are actually finding more and more what are the aspects that is actually social frailty.
Yeah, so before Mononita move to another slide, we just review which you have say in our group chat about your own understanding of social frailty. I just read some keywords you have written here. We have the isolation, at risk of phones, vulnerable, disconnected, lonely, a lot of isolations, yeah, lack of support from others, disengagement, phones, less resilience, low self-efficacy. I think these kind of words are quite relevant to the definition of social frailty we have so far. So to further, yeah.
Yeah, no, exactly.
Yeah.
You got the idea instantly. Thank you so much.
Yeah.
Thank you so much. So shall I move on to the next slide here?
Yes, please. Yeah, and
Okay.
we also explore this kind of aspect later in our presentation. Yeah.
Absolutely. Absolutely. Okay. Let's see the prevalence of the frailty.
Yeah, so the prevalence of physical frailty and cognitive frailty, the research indicated that the physical frailties among individuals aged from 65 and over ranges from 5% to 16% in community settings. And this rate increased to approximately to 40% among those aged from 80 years old. So in clinical settings and nursing homes, this prevalence can rise to as high as 85%. And globally, the prevalence of cognitive frailty is estimated to range between 1 and 5%. In Australia, around 1 in 6 older adults living in the community are at risk of frailty.
That's a
Next
high
slide,
number.
please. Yeah, very high number.
So the prevalence of social frailty, as I mentioned before, and will be mentioning again and again, that studies examining the prevalence of social frailty is limited because the concept is still evolving. And studies conducted on social frailty mainly in Asia, and some are in Europe. Social frailty has been shown to precedes physical and cognitive frailty. Prevalence of social frailty in hospital setting was over 47%, and in community setting, 19%. But saying that this is underreported because of the limited research. Even though it is limited, however, the association between social frailty, isolation, and loneliness are recognized as the way you put it on the chat.
Yeah. Yeah, and I will explore a little bit more about the social isolation and loneliness. So the research indicates that both loneliness and social isolations significantly increase the risk of frailty among older adults. While closely related, social isolation and loneliness are distinct concepts. So the social isolation is defined as a lack of social contacts and interaction with families, friends, and other wider communities. And loneliness is a negative feeling an individual may experience social isolation without feeling lonely, just as someone can feel lonely despite being surrounded by others. But the extended periods of social isolation can lead to feelings of loneliness. And similarly, prolonged loneliness can result in social isolation over time. Both social isolation and loneliness have been linked to adverse physical and cognitive health outcomes, further exacerbating frailty in older populations. Next, please.
So let's see how social isolation and loneliness impact or the impact of frailty on social isolation and loneliness and vice versa. During a 22 years of a follow-up study in Netherlands, which wanted to examine the combined impact of frailty, social isolation, and loneliness. In that study, of 1,400 people, more than 85% in the loneliness sample and 85% were in the social isolation sample died. As you can see in the two graphs, on the top graphs, the yellow line that indicates no frailty or not lonely. Those people who died, of course, that's the natural phenomenon of human being. But the interesting is the last two lines at the bottom, the second last line, that is only frail. As you can see, that only frail, they are likely have premature death, but people who are frail as well as lonely, the last line, they are more likely to die before. Similarly, the second graph, it says the same thing. The last two lines, the second last line, people who are only frail, the last one who are frail and socially isolated. So the result shows that frail older adults are at increased risk of mortality. But this risk was even higher for those who were also lonely and socially isolated.
Yeah, so we can see the connections between social isolation and some other diseases like the dementia. So increasing research evidence suggests that social isolation and loneliness are significant risk factors for dementia. And at the same time, dementia can contribute to social withdrawal, leading to increased isolation and eventually loneliness. And we can see that link between social frailty and also dementia. Yeah, next slide, please.
And I would like to say that while falls aren't an inevitable part of dementia, people living with dementia are more likely to experience a problem with like mobility balance and muscle weakness, which increases the risk of falls. And research shows that people with dementia have a higher incidence of injurious falls. So the next slide is falls and frailty. According to the National Council on Aging Statistics, every 11 seconds, an older adult is treated in the emergency room for a fall. In a study of 5,000 older people in Japan, found that about 1 in 4 people aged 65 and older had fall each year, and half of them had multiple falls. As we know that falls can lead to serious problems like disability, hospital stay, with repeated falls, making this risk even higher. So the association between falls and social frailty. Research has well established the link between physical and cognitive frailty and an increased risk of falls. However, the relation between falls and social frailty remains unclear. It's because lack of research, lack of understanding of what social frailty is. Experiencing a fall has been associated with feelings of social isolation, which can limit social connection and participations. That has been conducted by limited research that's been reported. And another study found that older adults who had frequent falls in the past year were more likely to experience reduced social roles and social engagement because of the fear, because they had previously fallen, so they had a fear of going out and socially participated and social engagement. So the coexistence with physical frailty and social isolation were found to associated with falling.
Yeah, so the research has shown that people from mainstream population and culturally and linguistically diverse population, we call the core populations, may be experiencing the social frailty in different levels. And some research have shown that the people from core backgrounds are at a higher risk of social frailty due to several key factors. The first is language barriers. So limited proficiency in the dominant language can make it difficult for individuals to access healthcare, participate in social activities, and seek support services. So this can lead to isolation and unmet healthcare needs. Next is the cultural expectations. So in many communities, traditional caregiving norms emphasize family-based care, which can discourage individuals from seeking external help even when they need it. And another important factor is migration-related disruptions. Moving to a new country often results in the loss of social networks, intergenerational separations, and difficulties in integrating into the main society. So these disruptions can make it harder to build social connections and maintain a sense of belonging. Finally, the limited awareness and access to services also affect the older migrants' access to social services and reduce the social isolations. So many older migrants underutilize aged care and social services due to various barriers like the eligibility constraints, lack of trust in the system, or simply because the culturally appropriate programs are not available to them. So when we understand the challenges, it's very crucial to developing better support system that promotes a social inclusion and well-being for core older adults. Yeah, next slide, please.
So as we have talked several times, that the concept of social frailty is still evolving, and there is a lack of understanding and lack of research that which factors are risk for social frailty or which indicates the level of social frailty. Hence, so what is the key indicators to identify social frailty and how we can measure the level of social frailty so we can develop appropriate intervention? Those researches are still in infancy. There are some scales, however, are used to measure social frailty, but these scales were developed within the research team and mainly in Asia, without involving the consumers who have got lived experience. And those scales were not validated, and if it was validated, were validated using a small sample size, and within one or two countries in Asia. And that is the reason we have employed a comprehensive study to develop a social frailty index. And how we wanted to do it, we wanted to establish consensus among experts globally. And who are the experts? The experts were people aged 60 and up, people who are living with frailty, their caregivers, and of course the professional experts such as clinicians, geriatricians, and researchers in the field globally. We wanted to make consensus on the indicators that indicate social frailty index and how we can measure it. So this study was conducted in 4 phases. In the first phase, we generated items with comprehensive literature review, the discussions within our research teams who has got expertise in these areas. We consulted with other professional experts through our collaboration. And we have generated a long list of indicators. In the second phases, we invited people who has got lived experiences, and we provided those indicators we got from literature review and as well as our research team discussion. We then consulted with those our consumer group. We revised those items. We went back and forth to discuss what are the important factors to indicate social frailty. We then identified that we reduced the first one was 120, more than 120, and then we reduced to 56, which were more important key factors. And then we piloted the survey. And this survey in phase 3, the survey we did online in 2 rounds. We sent among 200 professional experts around the world, and we also contacted 100 organizations globally. And we requested those organizations to forwarded our request and the 56 items among their clients, like the hospitals, aged care, nursing homes. And we requested to complete the survey. We received 100 response. And there we asked to send their UI so that we can contact them for the next round of that survey. What happened in the first round when we got their responses, identifying which out of the 55, which are the important key factors for social frailty. So 118, we did some statistical calculation, and then we went back to those people who said, yes, we would like to participate in the second round of the survey. And we showed them, so that many people says that this factor is more important than the other. So we listed that, and we all, what are the consensus of the experts' consensus who voted for the items that is most important. And we also indicated for individuals that person that indicated if these items was as a key factor. So the second round, individuals analyzed or reviewed their thinking of the key factors, and they reported to us. And this time we got 53 responses. And those responses, out of 53, 84% responses were from Australia, and some from India, Bangladesh, UK, Canada, Italy, Southeast Asia, and South Africa. Most of them were professionals experts, 25% of people who were living with frailty, and 17% of caregivers. And 26% indicated others they were possibly not directly experienced their frailty, or they knew someone had got frailty.
So what are the results of the two surveys? So we have identified 5 key domains of the social frailty index. And look at the slide, you can see these 5 domains: social engagement, social support networks, financial resources, well-being, and literacy. And in the following slide, we will explore each of these domains in details. So next slide, please, Mononita.
So out of 56 items, as we said, that in 2 rounds, we went back and forth. The vote, we only accepted which people voted which had got more than 70%. So we only took who had got more than 70% vote for each items. And we found we had got 28 items, and we have put it into subgroup that's here mentioned in 5 domains. The first one is social engagement. It's not any particular order. Social engagement. And what are the items in social engagement? Those items are whether they found that the important aspects, if people with frailty, that if they can contribute to the community with their knowledge and skills, whether they have new friends in their neighborhood, those are the key factors for social frailty. And their attendance of social gathering and events. And we know that from our discussions, these are the key factors for social frailty, as well as these are related to falls.
Yeah, and the second domain is social support networks. And this domain consists of 7 items. So they include the various aspects of social interactions and emotional well-being. So this includes enjoying interactions with family and friends, seeking help when needed, having someone who advocates for you, having people to confide in, maintaining close friendships, experiencing a sense of belonging, and the availability of necessary services. So all of these items are interconnected. And if people can have the wide social support network, I'm sure they will be less social isolated, and the feeling of loneliness will be less. And of course, it also helps you to prevent the phones. Yeah, next slide, please.
So the third domain is financial resources. How financial resources impact on risk of falls requires more research. However, financial instability may lead to poor nutrition, poor housing condition, poor neighborhood, leads to stress and anxiety, which are, of course, the risk factors for social frailty and may indirectly or directly increase the risk of falls. It's because research shows that poor nutrition and falls are highly connected. Recent study among 351 participants in Poland reported that falls were most frequent among widowed individuals and those with poorer financial situations, as well as those who previously performed more physical or manual works. So from working class with poor financial resources or financial instability. So this is connected to false again.
Yeah. So what about the well-being? So well-being is very important to all of us. And of course, when we understanding social frailty and measure social frailty, it's very important to consider well-being. And this domain includes the 9 items. So each addressing the key aspect of life that contribute to overall well-being of the person. So these encompass the feeling safe and welcome in your neighborhood, experiencing a pleasant and inviting environment for outdoor activities, practicing health habits, cooking nutritious meal. Yes, Monolita mentioned about the nutrition is very important to reduce social frailty and also reduce form, and also the feeling physically fit and healthy, maintaining mental health, and having a sense of purpose in life, feeling in control of your life, and spending time in nature. So the well-being overall, also in the physically, mentally, very important for us to stay healthily, physically, mentally, and cognitively. Next slide, please, Moronita.
So
And yeah, and the
with the,
last, yeah, please.
yes, with the literacy,
Yeah,
these the indicators for social frailty, which has got these are the items for the social frailty, which is in literacy domain. So how literacy is connected to false, that's also requires some study, of course, more research. However, in the same study in Poland, they reported the false were more common among less educated individuals. And that is also in our study, where we found that, so with the social frailty index, after we developed that 2024 items, what we did, we circulated that, we piloted that scales among 500 people in Australia. And what in the surveys indicated that overall surveyed population indicated moderate level of risk of social frailty. And we found that men were highly risk of socially frail than women. We also found that people with vocational training or similar have the highest score of social frailty, followed by those with secondary attainment. So this is also resonate with the previous study that people with lower education had more prevalence of falls. And one interesting thing what we found, that people having pets, who has got pets, having lower risk of social frailty. Possibly that gives the connection.
Yeah, so we have discussed the social frailty index in a very general context. So, but when we considering the cultural aspect, the questions arises, do we need to adjust the index to reflect the cultural differences? And our answer is yes. So the social frailty of core migrant populations is significantly shaped by their unique migration experiences, cultural expectations, and social structures. However, existing social frailty measures fail to capture several key factors, including the cultural differences, migrant-related barriers, differences in social engagement and support structures, and policy intervention strategies. So as Mononita has mentioned, our social frailty index that has been built within the 50 trial projects. That one, we try to target more corn populations. But when you look at the slide, you can see that more mainstream Australia responded to 2 rounds of surveys. So we just feel that, and we identify that maybe we need another testing, another development of social frailty index that are culturally relevant and sensitive to capture all the lived experience of social frailty among the older migrants. So you can see that the cultural differences really influenced by the family dynamics, social roles, and community participation. And the migrant-related barriers such as the language challenges I mentioned before, the limited access to social services, disrupted social support networks, transnational care responsibilities, visa restrictions, and a lack of culturally appropriate support system also contributed to increasing social frailty. Especially the differences in social engagement and support structures, which are largely shaped by the cultural norms and care preferences. So, for instance, in the collectivist cultures, intergenerational reciprocity and family-based care are emphasized, whereas the individualism places value on independence and self-reliance. So this can result in the vulnerability of those who depend on family-based support being overlooked, particularly in the countries where individualism is dominant. So also another aspect is that policy and intervention strategies can be misaligned, as the risks faced by the older migrants may be misinterpreted and leading to ineffective responses of the policy to the older migrants. Next slide, please. So it's the reason why we are trying to address this gap. We are in process of developing a culturally sensitive social frailty index with migrants from Southeast Asian backgrounds in Australia as the pilot populations. And we do hope to have the preliminary result next year to share with you.
So
Yeah.
This is our last slides. The closing thoughts is the level of social frailty may vary across different populations and the falls may vary different populations. Measuring social frailty is crucial for preventing and reducing the risk of falls, disability, morbidity, and premature death.
Yeah, so ineffective scales allow for the design of interventions that can improve quality of life, alleviate financial burdens on families, and reduce healthcare costs. We also advocate for the greater collaboration between researchers, governments, and communities to prevent social frailty and promote healthy aging and well-being. So I think we just have some questions online already. So we want to close.
You.
Close our presentation now, and we open floor
is there any question?
For questions.
And I will stop sharing. Going back to Elena. Elena, handing over to you.
Sorry, I just said all of that with my microphone muted. Thank you, Dr. Monanita and Dr. Shen for that presentation. I really enjoyed learning about the development of the SAGE Social Aging Index and the different phases you went through. If you have any questions, please put them in the chat box and I'll read them out. I think there are a few already there. Is the SAGE Social Aging Index just reviewed available for use by industry, or is it in development validation?
So this is, even though we have piloted, this is in development with the validation. However, identifying those 5 domains, the indicators will be available. We talked to Belena that we are developing an infographic where we have got the 5 domains and how it is connected to false. So we are developing, and I will, once we finalize, we'll send it to Belena, and she will circulate with you, just to measuring that the level of frailty, what is the scoring, this is what in the development phase. Otherwise, the indicators are developed.
Okay, thank you. Alison asks, what setting is SAGE predicted to be used in?
Yeah, do you want to
I
do
think
that?
you respond this question better than me because
Okay.
you understand more about when the indicators are ready for use. Yeah.
Yes. So, as I said, that the indicators, the key concept or key indicators are understandable by general people, that which aspects they need to enhance, to think about, and to reduce the level of social frailty and reduce the risk of falls. However, I said that we are still developing the scoring system. Once we do the scoring system, that will be more like for the researchers to level that, whether at which level they are socially frail. And still developing, but that gives an idea of thinking about if we can develop any interactive scales. But hey, your question actually give me that idea. Thank you so much.
Yeah, and we expect that we can apply the index measures in different settings, including in the industry, in hospital, in research, and
Aged care,
yeah, and aged
nursing
care,
home.
yeah, and home, and any kind of the measurements by the government to evaluate the social frailties aspect of our populations. And we're also trying to collaborate with more research teams and also industry to test this social frailty index. Yeah.
So
Okay,
we are open to collaborate with governments to do the validation and
Yeah.
finalize the scoring system. Please, if you have the capacity, please let us know to collaborate and to implement the survey to identify and finalize the scoring system.
okay, thank you. Magnolia asks, says, fabulous presentation, great piece of work, highly needed. Did you conduct confirmatory factor analysis to verify the construct validity, internal consistency, and reliability?
So yes, we have, in those domains, we have conducted the exploratory factor analysis. We have done the retest of the content validity. These, the manuscript are in progress, so we'll finalize it and we'll publish it soon. So yes, we have conducted the necessary statistical analysis to identify that's the psychometric properties of this value. And also, I would like to say that these scales are being used in the National Frailty Research, which has got the funding from MRFF, Medical Research Future funding. That's the national study, which is led by Queensland University, and these scales is being used. So once we get the results, we will be able to do the final validation of the scoring system as well. Thank you.
Yeah.
Thank you. Kirsten asks, what is the best way to follow your work?
Actually, we have our LinkedIn profile for Social Aging Future Lab. We have our website, and we normally updated our most published, most recently published paper and most our recently work. And also you can contact with us through our email. We can share our email here again in the group chat, and also our LinkedIn profiles, and also our website. So I will post all of them here. So if you have any kind of interest in collaboration with us, or maybe you have any questions related to this presentation, we are happy to respond and to answer your questions and your queries. Yeah. I will post some of the link now in the group chat.
Thank you. I think that is most of the questions, so I will now move on.
Just one thing, that when we were planning to develop the social frailty index, of course, we thought that we will involve people around the world, and we want to establish the consensus of the experts in the development of this social frailty index, the experts from globally. We also planned and aim to develop the indexed so that that can be as simple as possible and can be completed, the questionnaire, within 5 to 7 minutes maximum, because we understand the research fatigue. Because when we send the questionnaire to people, they are bombarded with lots of surveys and questionnaire, and many questionnaires take more than 15 to 20 minutes. So we want to finish within 5 to 7 minutes maximum, and that should be calculated as easy as possible.
So excuse me, Benella, I cannot engage in the chat. I cannot type anything. Can you guide me how to do that? I cannot post the link here. Yeah.
I think Joe will be able to help you with any tech issues.
Yeah.
So I think she can help you in the background.
Yeah, so how can I post the note in the chat for our emails? Because we have some participants just ask us to send the contact, and they want to chat more about the implementation. Yeah, I think there is one question from Chancy. Chancy said that I would love to see SAIS used in the emergency response setting as one way to identify early flags for prevention of future phones and implementation of additional service early. I would keen to chat more. Yeah, we are happy to chat with you further about this. But actually, I still don't know how to share our contact.
If you can't figure it out while I finish the presentation, you can send me all of your information, and
yes.
I can email it out to all the registrants after the presentation.
Okay, thank you. I will do that.
Okay, perfect. Thank you all for those questions. I will now go through our Stay on Your Feet program and how you can be involved. We have a suite of resources that you can use in your workplace or with your clients. If you head to our Injury Matters website, you can find all of our resources available, which you can download and print off for free. We also offer 2 free self-paced online learning modules, the Introduction to Falls Prevention and Exercise Strategies and Screening for Falls Prevention. Online modules provide professionals with background knowledge of falls, age-related changes, and how these can impact an individual's function, mobility, and falls risk. These modules will help you facilitate falls prevention exercise strategies for older adults. I would now like to highlight the upcoming events we have planned. Our half-day family and domestic violence event was very popular, so we've organised a full-day family and domestic violence training to cover more content. Applying a family and domestic violence informed lens training on the 6th of May will go over what family and domestic violence and coercive control are, gendered drivers, violence against Aboriginal women and children, family and domestic violence myths and biases, and much more. On the 15th of May, we have the Falls Forum, Vision Impairments and Falls Prevention in partnership with Visibility. This event will explore different eye conditions and their impact on falls risk, assistive technologies to support people with vision impairments, and home modification and community access for reducing falls risk. You can join this event online via Microsoft Teams or in person at the Visibility office in Victoria Park. On the 22nd of May, we have our Dementia Enabling Environments for Falls Prevention webinar. We will have guest speaker Nick Seaman from Dementia Training Australia look at dementia and its effects on falls risk and how to create supportive environments for people living with dementia. You can register and read more about these events on our events page. Please share these events with anyone you think may find them relevant. I am very excited to share that nominations are now open for the 2025 Injury Prevention and Safety Promotion Awards. These awards recognise the hard work of individuals and organisations working to prevent injury and support recovery in WA across 5 different award categories. You can download the nomination booklet through the Injury Matters website, which has further information about what you can nominate for. If you'd like any more information or guidance, we encourage you to get in touch with us at Injury Matters. And if you know of a worthy program or piece of work happening in WA, we encourage you to either let them know about the awards or let us know and we can reach out to them. Nominations for the Injury Prevention and Safety Promotion Awards close on the 17th of April. Please save the date for our upcoming Injury Prevention Summit. The Injury Prevention Summit is a one-day event held every 2 years by Injury Matters through the No Injury program with funding from the WA Department of Health. The summit will bring together injury prevention and safety promotion practitioners, policymakers, and representatives from local governments across Western Australia to share knowledge and strengthen their capacity to integrate injury prevention and safety promotion into their work. The summit will be held on the 12th of June with the theme, The Future of Injury Prevention. As mentioned at the beginning of this webinar, we would love to hear your feedback about what you thought about today's webinar. Your feedback helps us ensure that we are delivering sector support that meets your needs. Please use this QR code to complete the survey. Thank you so much. Thank you again for taking the time to tune in to today's webinar, and to Dr. Monanita and Dr. Hyun for sharing this information. Please connect with us. We are on various social channels. You can also sign up for our Falls Prevention newsletter and our Community Falls Network.